welcome to Functional Fridays. I'm Dr. Sherry Jacobs, and this is Dr. Sharon Kennedy. So we were just actually chatting about sugar, and I think sugar is probably the most addictive substance on the planet. And for people that are my sugar people, you know that very well. We've been talking about sugar people forever because sugar people find a way to get sugar in, whether it's even healthy sugars like extra pineapple and mango in the smoothie, or you go to get nuts at the store, but you get the trail mix with the dried cranberries and the chocolate chunks. And so if you're a sugar person, you know that you're a sugar person. It's a very addictive substance. So
even salt people, I find they say to me, I don't have a sweet tooth. I like salt, but they like salt on their potato chips, and the chip is sugar. Yeah, and so if you were just eating salt out of a bowl or salt on a slice of cucumber, you'd be fine. But it's the sugar in the chip that's the problem. So yeah.
And I was thinking about some of the things. I mean, there's oftentimes people come in and sugar has gotten to the point where they are now overweight, and they are, in this cycle of, trying to not eat sugar and then overeating sugar and not overeating. And then usually coming in pre-diabetic or diabetic. And I think that there are a lot of different ways that we can assess for that many years before somebody actually gets into the throes of diabetes. What kind of labs would you think about running years prior?
Yeah. Well, in conventional medicine, we usually once a year on a person check up fasting blood sugar, which we would like to be under 100. We'd really like it to be in the 70s and 80s, but most average American will come in right at 99, and we're like, oh good, you're not pre-diabetic. But we do that once a year. But really, if 10 years earlier we were checking insulin levels, fasting insulin levels, we would see that the person's body was having to oversecrete insulin to balance out all of the extra sugars that are in the standard American diet. And when we see that high insulin level, and we see that the person has gained a little bit of weight or feeling sluggish, fatigued, having hormone imbalances, things like that, if we can at that point say, look, let's change your diet, we're not going to see diabetes or these other diseases develop.
Right, and that's the key. Even on some functional tests that we do, like there's a urine test that we run called an organic acids panel, and you can look at the lactic acid to pyruvate ratio there, and again pick up somebody that's what we call a sugar burner years before it ever manifests at a cellular level, and we're actually seeing it on labs. Obesity has been coming up often, I think these days, because it's a comorbid condition with COVID that we're seeing now. And so what do you think about sugar and the immune response?
Definitely sugar decreases the body's ability to fight infections, one through lowering your immune system, but also sugar feeds the virus, sugar feeds bacteria, sugar feeds yeast, and so we need sugar for all these things. And so we wait until a disease is presented to us, whether it's outside our front door, like the coronavirus, or within our bodies, like when a cancer develops, or we get told we have diabetes or high cholesterol. And then we say, well, what can I do about it? When really, if we are ready for these things, then we're at much lower risk for contracting these diseases. And the way we can do that is by keeping our insulin levels low, keeping processed sugars out of our diet, and being healthy so that no matter what the world presents to us, our bodies are ready to fight.
Right. It's about the system and the terrain, and that becoming the balance to ward these things off in the environment, because we're always going to have some assault to the system through the environment. And so the things that we can control, like sugar intake and our ability to process sugars and things like that, are going to help our defense system, so we can walk through the world with a little more confidence, I think, when we're exposed.
Yes. I look at having extra fat on the body as a symptom, and it's a sign that we need to do something. And we gotta remember that there's a lot of people out there that kind of fall under the umbrella of something called skinny fat, where they don't have the fat rolls on their belly that bring them to the doctor to say, hey, I want to lose this weight, but they still have high sugar diet, and they are still at high risk to develop diabetes, to contract infections, to develop cancer, to develop heart disease. So we don't want to overlook skinny fat as well. It's out there.
Yeah, it is out there. Yeah, and those people don't come in as often because it's not as visual.
Yes, yes. So it's a really important topic. There's really not a disease out there that is not touched by sugar and insulin, and so it's always a topic that should come up when you talk to your doctor, or come talk to us about it.
Absolutely. Thank you.